When someone takes their life, we're not really sure of what's behind it. Many times, what's behind it is a condition called PTSD, post-traumatic stress syndrome. More than 7.5 million people in the United States struggle with this, and the number is probably even higher with the event of the pandemic. I think what's important about PTSD is to remember that it goes on for years. In fact, if you don't get treated, it may never cease. You may be able to work on it better, but it will for sure limit your life. And that's why we want you to get treated if you have it. Anyone who struggled with a traumatic event of any kind, it could be abuse in childhood, it could be a bad date, it could be seeing a shootout, it could be being in war in the case of veterans, it could be being a frontline worker, cops, firemen, anyone like that. It could be you if you were ever attacked. In fact, my daughter was held up at gunpoint one time, and she struggled and showed symptoms of PTSD and finally had to get help to get through it. I think what's most important is to remember that PTSD is tricky, and it doesn't always show itself till months or maybe even a long time after. And then after you get to a safe place, it seems to start showing, exhibiting signs. So what are the intrusive memories? What do they include? Things like flashbacks or reliving the traumatic event for minutes or even days at a time in some cases, unsettling dreams about the traumatic event. And you'll see symptoms evidenced by the person's attempt to emotionally numb themselves. And many times, because your loved one, you're not good at picking that up in someone, I'm going to give you the signs because you may have seen it. You just didn't know what it was. They try to avoid thinking or talking about the traumatic event. They want to forget about it. They feel emotionally numb. You've noticed they're not really hot or cold. They're just lukewarm. They're just in the middle. Avoiding activities they once enjoyed. Hopelessness about the future. Memory problems, severe memory problems in most cases that I've seen. And trouble concentrating. And symptoms of the emotional arousal that you may see they're edgy or they're jumpy at the smallest thing, something that shouldn't cause a reaction. They feel very uneasy or nervous, and they're on the verge of intense anxiety, like they just live on that edge. They're overreacting for the situation at hand. Like something will happen and they'll go way overboard with their reaction. Like they may hear a story on the news and all of a sudden, like clean out their guns and get their guns ready. And it's like, what are you doing? That was something that happened millions of miles or thousands of miles away. It's not happening here. Feeling intense guilt or shame. Self-destructive behaviors like drinking, smoking, driving recklessly, sometimes self-cutting if it's a teenager or a younger person. What's most important is post-traumatic stress syndrome is treatable, but you need a team to help you through it. A loved one, like if you're married to someone with it, that's not enough. You're going to need a physician and you're going to need a therapist. So the first thing you should do when you notice these is seek professional help. Get your loved one a doctor's appointment first. And then tell that doctor exactly what they've been going through and ask if you can get help with a mental health counselor. That counselor should be licensed and they should know how to treat PTSD because it is a specific area. And if you don't have that training with trauma, sometimes your therapist won't be helpful, helping guide you through. Secondly, set up a security plan in your home. When people are under the influence of a PTSD flashback, they are not safe. So you need a safe place you can go, a safe number, whether it's a police authority or whoever that you could call, who could come over or that you could flee to help you with your loved one who has PTSD. Have a wireless phone available. Sometimes in the middle of the night, if you have PTSD and you get into the feeling like a smell or some psychological cue goes off in your mind and you start reacting to whatever the traumatic event was, you lose sight of what you're doing and you may become violent toward yourself, your loved one, or others. So it's very important that you have a wireless phone so that you can warn a coworker at work who you know agitates your loved one, or anyone that you think your partner could potentially hurt. It's important that you can call them, because sometimes when your loved one has PTSD, they've already thought about you making a call or warning a person, so they could cut the phone line. And it's important you have a way to communicate with that person other than a phone line. If you notice your spouse is more depressed or angry or anxious, now I'm assuming this is a spouse. If it's a loved one or a partner, then it's important that you call at that time the authorities. Don't wait, because it's in waiting until you're at a stance like, oh my gosh, I can't believe they did this. Like, you want to wait because you want to see if they can work it out. Don't do that with PTSD. It's not one of those illnesses you have time for. You basically, if you start noticing they're more depressed or whatever, call the authorities so that you can get immediate help. And lastly, the best plan is for you to get as much education as you want, get your partner into treatment, and then from there become a part, an alliance of their treatment team. The more you're able to work with your partner, when they get in that frame of mind, you're able to go there with them, talk to them, calm them down, remind them they're in reality, be a present, be there for them. Like, that's not a time for you to flee. They need you in their life. They need reality. The better your partner's going to do. I think when couples work on PTSD together, honestly, they can overcome it. I've seen it with my clients. But the most important thing is you don't become fearful of it. And the way you don't become fearful of anything is to get educated. When we understand what's happening, we're better able to handle it.